You've probably wondered at some point whether or not mold could be affecting your health, especially if you've been dealing with symptoms that don't quite add up. But the conversations about mold exposure can feel both scattered and extreme at the same time. So in this video, we're going to bring some structure to it. We'll clarify what mold-related illness is all about, what kinds of symptoms tend to raise suspicion, and how testing fits into the picture. I'm Dr. Kenny, IFM certified functional medicine practitioner, and I focus on helping people when the picture feels incomplete. If you appreciate clear root cause conversations that help you sift through the noise just like this, go ahead and give this video a like and I'll create more just like it. And one of the reasons this topic becomes confusing is that mold illness rarely looks the way that people would expect. We see it on social media as a black patch on the wall, a strong musty smell, something that everyone you would think would notice. But in reality, the situation is often much more subtle. Mold growth can happen behind drywall, inside insulation, under your flooring, or anywhere moisture has been trapped for a long period of time. Modern buildings are also tightly sealed for energy efficiency, which means air can circulate particles without anybody truly noticing it. So one of the first misunderstandings is that if mold was really a problem, that it would be obvious. Another common misunderstanding is that mold affects people the exact same way. Environmental exposures across the board don't work that cleanly. Two people can live in the same environment and have very different experiences. And large population studies have validated findings exactly like this. Recent research examined tens of thousands of participants, and it revealed that people living in damp or mold-infested environments reported significantly higher results of fatigue and systemic symptoms compared to those living in healthier buildings. And if you're one who likes to see the research, I've put together some of the articles that I used in this video for you to peruse at your pleasure. It's in the pinned comment in the description below. Environmental exposures do not always show up as a single disease. And mold in the wellness space is known as one of the great mimickers. When clinicians describe something as a great mimicker, they mean that it can resemble many different problems depending on which part of the body is showing the signs of stress. And this is exactly what we see in mold illness. One person may experience extreme fatigue and brain fog, another new allergies or skin changes, and it can even tip the scales into sinus infections and headaches or migraines. Because these symptoms appear in separate systems, they're often evaluated in silos in our conventional space. You may go see a neurologist or a hormone doc for the fatigue, or perhaps a GI for any gut-related symptoms. Each piece or symptom is treated individually, and so the bigger picture in the context of mold illness is often missed. This is why the unfortunate reality exists that many patients who are suffering from mold illness often bounce around between multiple practitioners before somebody hits the nail on the head. So the main theme to remember here is that the body doesn't just respond through one particular pathway. Several systems are often involved at once. So to understand why mold exposure can influence so many different parts of the body, let's first look at how it affects immune signaling and inflammatory stress. The immune system acts as the body's surveillance network. Its job is to recognize potential threats in the environment and to mount a response against them. When something irritating or potentially toxic is encountered by the immune system, immune cells release special signaling chemicals called cytokines. Cytokines are the chemical messengers that tell other parts of the immune system and body cells how to respond. In the short term, this process is incredibly protective. It helps the body to neutralize the threats and also repair the damage on the other side. But when an environmental stressor such as mold toxins persists for a longer period of time, those immune signals can remain active for longer than intended. And that's where new symptoms tend to emerge. The response to this immune signaling is inflammation. And when chronic or prolonged, it doesn't stay isolated to a single part of the body. Those chemical signals circulate and they affect many tissues at the same time. The brain, the nerves, the stress chemistry, the hormones, your skin or your digestion. And this is why symptoms can appear in multiple systems at the same time. Researchers studying mold-affected indoor environments have actually begun mapping some of these biological connections between systems. And a recent scientific review identified several biological pathways linking dampness and mold exposure with both neurological and stress-related symptoms. And what this highlights is the fact that exposure to mold can influence the body through these immune-driven pathways, not just through allergic or infection type pathways. Now, of course, the immune system is not the only system that's involved. The next layer we're going to talk about is how the body manages and produces cellular energy. This is one of my favorite topics here because inside every single one of your cells are structures called mitochondria. Mitochondria are responsible for transforming the nutrients that reach the cells, as well as oxygen, into energy. When they're functioning well, each and every one of your tissues, from your brain to your skin and your muscles and your digestive tract, function at their best. But mitochondria are very sensitive to chemical stressors, and that includes the toxins from mold. And not just the toxins themselves, but the immune and inflammatory signals that we mentioned previously. When stress accumulates, your mitochondrial pathways can slow down. And when your energy production drops at the cellular level, not only do your cells suffer, but your organs and your tissues. The brain is one of the first that goes because it requires the largest amount of energy. But here's another key point for this discussion and a nuance that deserves some attention. Even though individual symptoms can be clues, symptoms alone don't tell us which system is under strain. They only tell us that something in the network is struggling to function optimally. Research that examines the mitochondrial response to environmental toxins have shown that disruptions in this mitochondrial processing chemistry is linked to inflammatory signaling and poor immune signaling as well. Or in other words, when the body is under this kind of environmental toxic stress, the systems for both energy production and detoxification and immunity are often affected together. And that's where functional testing can become useful, because certain specialized laboratory tests allow us to look at these specific metabolic pathways to see how your cells are functioning, not just whether or not an exposure exists. So now at this point, let's start shifting the conversation to another common question that comes up. If mold exposure is a possible part of your story, how do you actually test for it in the most meaningful way? And the answer to this question begins with understanding that different types of mold tests are designed to answer different questions. When this question comes up, and especially in wellness marketing language, you'll often hear about the best test. There's environmental testing for testing your home or workspace, but also urine testing and blood testing and allergy testing. So which one of these is truly the best? It can start to sound overwhelming when everyone's recommending a different approach. There are 3 different questions that are important to ask when we're looking at a mold toxicity workup. The first question is this: is mold present in the environment? This is often a great place to start, and this is the type of testing that tests the building or the environment itself. There's air sampling, surface sampling, dust sampling, and they can sometimes help determine whether or not mold organisms are present. That information is useful because if they're present in your environment actively, that is potentially a source of consistent exposure. And you could do all the mold detoxing protocols in the world, but if you're consistently exposed to it, it won't move the needle in a big way. But the environmental testing alone doesn't tell us how your body is responding to mold and mold toxins. Which brings us to the second big question. Has the body been exposed to mold or mold toxins? Some laboratory tests are designed to measure the presence of mycotoxins, which are the mold toxins that are produced by these organisms. These tests are often performed through a simple urine sample and can help to provide evidence that mold toxins have entered the body at some point. But even that piece of information doesn't tell us the full story, because the presence or the excretion of a toxin doesn't necessarily tell us how the body is handling it or how it's affecting your physiology. And that leads us to the third question, and perhaps the most important, or one of my favorites. How is the body responding to mold exposure? This is where functional and systems-based testing can become particularly helpful, because instead of asking whether or not mold exists or the toxins are present, these tests look at how your different biological systems are responding. Is there more inflammation in your nervous system? Or how is the burden of oxidative stress? Are your mitochondrial energy pathways struggling to produce enough energy? Those kinds of questions help us to understand the physiological or functional terrain that the body is operating in. And once we understand that terrain and your unique biochemical environment, becomes a lot easier and a much straighter line to designing a specific protocol to your chemistry that is grounded in your objective data to help with recovery. And of course, there's another important nuance here I'd like to share with you. Even though all three of these categories of testing can provide useful information, none of them are perfect on their own. And understanding the strengths and the limitations of testing is one of the most important parts of interpreting them correctly as well. So next, let's talk about why mold testing can produce conflicting or confusing results. At this point in the conversation, people expect the testing to produce very clear results. Either the test is positive or negative. Either mold is the problem or it isn't. But in reality, mold testing and the effects of mold is rarely black and white. One of the biggest reasons is that the body is not a static system. It's constantly adapting, it's constantly sending additional signals. For example, when a person takes a urine mycotoxin test looking for the presence of these substances in their urine, the result can depend strongly on how that body is handling those toxins at that moment in time. If detoxification pathways are slow, for instance, because of exertion or perhaps genetic potential, toxins may not show up strongly on the test. On the other hand, if your body is actively mobilizing them and you just used the sauna, the same person might show higher levels. So it's important to remember that most tests represent a single snapshot in time, not necessarily the range of the burden that exists. And testing your environment has similar limitations. If mold spores are not circulating in the air at the moment, it doesn't necessarily rule out the fact that they may be behind the wall or underneath the flooring. And allergy testing adds yet another layer. Those tests are designed to measure immune reactions to certain mold proteins, which is different from measuring the exposure to mold toxins and how they affect the cells. So a person could strongly react to allergy testing but not show signs of mycotoxin poisoning, or vice versa. So when you step back and look at the bigger picture here, this is what makes the conversation around mold testing so confusing. Different tests answer different questions fundamentally. And if those answers are taken out of context or too black and white, they can appear contradictory or worse, lead to poor treatment outcomes. Which is why it's so important to try and interpret testing through a systems-based lens. Instead of looking for that one single test to explain everything, we look at patterns across environmental exposure and physiological function, and the body's stress capacity and detoxification system. So if mold testing doesn't offer a single definitive answer, you may be asking, well, how does a clinician decide which mold testing to use? Simply put, choosing the right test goes back to what question are you trying to answer? Sometimes it's environmental, sometimes we're wondering if there was a previous exposure that doesn't exist anymore. And one of the downstream questions I'm often asking is, how are that individual's systems responding overall? Because by the time a patient comes into my office with suspected mold exposure, they're often dealing with a broader pattern of interconnected systems involving the immune system, the energy systems, and more. And that's where advanced functional testing can come in to show us how the mycotoxins might be affecting the person. For example, organic acids testing gives us a deep dive insight into mitochondrial function. We're essentially looking at the chemical footprints in a urine sample that may elucidate roadblocks that are occurring in that important chemistry. So when I look at these markers of mitochondrial metabolism, say that 3 times fast, I'm often trying to answer a slightly different question. Instead of just, is mold present? I'm trying to ask, how resilient are the body's systems right now? Because that information can guide how aggressively or conservatively we attempt to treat mold as well. And this brings us to an important misconception that often shows up in conversations around mold illness. There's this idea out there that there's a panacea or there's one particular protocol that can work for everyone. So let's talk about why this assumption can often create more problems than solutions. If you've looked for mold detox protocols, you've probably seen different practitioners claiming there's one pathway that works for most people, the one-size-fits-all approach. But in practice, again, physiology rarely works that uniformly. And this goes back to the fact that the systems involved for each person may be very different based on their unique chemistry. For one individual, the immune signaling disruptions may be their predominant pattern. For another, the mitochondrial energy production is the worst. And this is the reason why I like to turn attention to systems integrity first. Because when your body's energy systems are depleted or your stress chemistry has been overtasked for too long, pushing aggressive detoxification strategies or layered protocols too quickly can often make symptoms worse rather than better and may add further cumulative stress to an already stressed out system. Testing helps to bring some clarity to that decision-making process. It answers the big question, does this individual patient have the capacity it takes to overcome this particular roadblock, whichever it is that shows up for that person? That information helps to guide the pace, the strategy, and more importantly, the predictability of treatment, which brings us back to that one central idea that we started with, that mold testing is not about finding the one perfect test. It's about asking better and related questions to understand how different systems are connected and communicating in the body. Once you start thinking about mold illness through this systems-based lens, another question I commonly hear is, why do fatigue and energy and brain fog become part of the clinical picture of mold-related illness? That pattern has a lot to do with how mold toxins interact with mitochondrial energy production. So if you're curious about how your little energy factories in your cells are affected by mold and mycotoxins, this video here goes into that exact topic. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.